Launch of the cancer drug list, and how might this impact you? A Straits Times headline in April this year caught my attention. It reads, "Cancer patient ends up with $33,000 bill after insurer refuses to pay for drug." Miss Ko is a bowel duct cancer patient. She is insured under a GE Integrated Shield plan that covers private hospital care and a rider that takes care of a portion of the bill. Even though the cost of treatment would cost more than double that of chemotherapy, both her doctor and herself assumed that claims for treatment would not be a problem. However, it came as a shock when GE refused to pay for claims for the new drug used. Each session costs more than $8,000, and in a short span of 3 months, from November 2021 to January 2022, the cost of treatment amounted to more than $86,000. GE paid out a total of $53,000+, but for the remaining $33,000+, the claims were denied. The reason is this was because the new drug used in her treatment has not been approved by the regulator, the Health Science Authority of Singapore, for the treatment of bowel duct cancer. The HSA had approved the drug in 2018 for the treatment of HER2+ breast cancer. If you look closely at the policy terms and conditions, a good number of integrated shield plans in Singapore contains this exclusion. New drugs, like what was used in Ms. Ko's case, are deemed to be experimental drugs, and experimental drugs are very costly, and they are only intended for specific cancer treatments. From 1st September 2022 onwards, health insurance coverage for outpatient cancer treatment will be tightened and restricted to a list of drugs approved by the authorities. This is a step taken to rein in the escalating cost of cancer treatments in Singapore. What can we expect from this new development? Number one, there is now an approved cancer drug list, or CDL for short. Number two, the cancer drug list has kicked in for Medisave and MediShield Life withdrawals and claims from September 2022. Number three, this tightening will apply to all integrated shield plans from April 2023. And number four, if a drug is not included in this cancer drug list and the patient wishes to go ahead with it, the patient needs to know that a big chunk of the treatment cost, i.e. payable by cash, will be borne by him or her. So you may ask, what is this cancer drug list? The cancer drug list is a newly drawn up drug list that is formed with input from doctors in the public and private sectors. It consists of a list of clinically proven and cost-effective outpatient cancer drug treatments that can be reimbursed by MediShield Life and integrated shield plans. So what is the key focus of this drug list? It is the cost-effectiveness of treating a specific cancer. If a drug is proven to be effective but very expensive, it will be deemed to be not cost-effective and excluded from the list. A drug is considered cost-effective if incremental benefits compared with standard care justifies the price tag. On the other hand, a cheap drug that does not improve care is not cost-effective. So what this means for cancer patients is that they can only obtain off-label medication by paying upfront without insurance subsidies from April 2023 onwards. Off-label medication refers to the use of other drugs not on the list or drugs that are used for other indications to treat the cancer condition. For example, if a drug that is listed only for treating breast cancer is used for the treatment of lung cancer, this is considered off-label, and the patient has to fork out cash from his or her own pocket. And there is also this concern that the cancer drug list may not be comprehensive enough to cover all cancer treatments. In an article published in the Straits Times on 5th July 2022, it said that about 10% of treatments used in the public sector are not covered. Well, how can we respond to this change in the health insurance industry? Well, my immediate reaction is this. The launch of the cancer drug list further highlights the fact that we must be prepared financially in the event that life throws a curveball at us. We need to either set aside more funds for major illnesses or increase the amount of coverage through critical illness plans. It is my personal opinion that the most optimal way to fund this potential financial liability is to leverage on critical illness insurance. While your hospitalization or health insurance helps to defray a bulk of the hospital bill for surgical and inpatient treatments, bear in mind that this is via a reimbursement basis. By reimbursement, it means that you pay cash first before the insurer pays you. On the other hand, critical illness plans will pay out a lump sum once the illness is certified by the insurer's panel doctor. This lump sum is given to you on a cash benefit basis, and you are free to spend the money however you wish. You have the freedom to choose your treatments without any worries. So what does this all mean? It means that critical illness lump sum payout equals freedom to use it however you like. In the past 2 years, I had the chance to speak to 3 cancer patients, and they all agreed that they have underestimated the out-of-hospital expenses. And these can actually add up to a substantial amount. All 3 of them wished that they had bought more critical illness insurance while they were still in the pink of health. These expenses include working life income replacement, i.e., the ability to compensate for loss of income while seeking treatment and recovery, home improvements, nutritional needs, alternative therapies, and the cost of new drugs or treatments not approved by the authorities for treating that particular condition. As life expectancy increases, so does the risk of cancer. Cancer is the top killer in Singapore, and it accounts for 29% of deaths in 2020. But with improved treatments, more than 50% of patients can survive this disease. And importantly, what action steps can you take to mitigate cash flow issues? My opinion is this: ensure that you are covered under a good hospital and surgical plan, and that you have comprehensive and adequate critical illness coverage. This combination forms your best defense against the financial impact of major illnesses. Is your financial plan built upon a solid foundation? Do a review with a certified financial planner who can help you to determine the critical illness coverage you need and whether there is a current shortfall. In summary, we cannot predict what major illness we will suffer from and whether that illness will require the need for a new drug or treatment. But we do know that if someone is suffering from a major illness, he or she will try all means to seek out the best treatment possible to buy back his or her life. Nothing else matters more than life itself, don't you agree? Then the next question is, can you afford the best treatment given the new changes? It is important to note that your health insurance is not a substitute for critical illness insurance. If you are unsure, it is time to review your critical illness planning and take the necessary actions to beef up your coverage before your good health takes a toll. This is Karen Tang signing off. If you have any questions for me, you can actually reach out to me at karentang.sg.